In Paraguay, members of the campesino movement held protests denouncing President Mario Abdo Benitez's non-compliance with the agricultural refinancing agreements. In Uruguay, an Air Force helicopter carrying Pfizer vaccines against COVID-19 crashed on Thursday. A giant container ship that ran aground on Tuesday continues to block the Suez Canal. From the headquarters of TeleSUR English in Havana, Cuba, this is From the South. I'm Gladys Quesada. In Paraguay, members of the campesino movement held a new day of protest to denounce the non-compliance of the government of President Mario Abdo Benitez with the agreements of agricultural refinancing. The protest took place in the capital, Asunción, on the eve of the Great Annual March convened by the National Campesino Federation, FNC, and the National Farmers and Indigenous Coordination. The campesinos who arrived in the capital from various departments of the interior of the country demand resignation of President Abdo Benitez, whom they accuse of corruption. It's important to highlight that in the middle of the protest, the Ministry of Health announced the total occupancy of beds in the health centers for patients with COVID-19. Unions in Brazil called for a nationwide strike action in defense of human rights and life, faced with the economic and health crisis caused by the COVID-19 pandemic. According to workers from several states, the protests are motivated by various issues, including denouncing President Jair Bolsonaro's handling of the pandemic, which has led to the worst health crisis in the country's history, with hospitals on the verge of collapse. Unions have stressed that the Bolsonaro administration's dismissal of the seriousness of the pandemic has created a division between health, life, and the economy that only harms the population. Several social movements have joined the protests and stressed the urgent need to act in the face of some 3,000 COVID-19 fatalities per day. In the meantime, President Jair Bolsonaro announced the creation of a national committee to fight the COVID-19 pandemic that has resulted in a death toll of over 300,000 in Brazil. Bolsonaro stated that he had set the first activities of the committee that will promote a task force between governors and mayors, many of whom have condemned the president for a lack of cooperation with state-level administrations to combat the virus. The head of state claimed that he defends life above all else, despite the fact that he has ignored expert advice on social distancing, the use of masks, and vaccination.
We resolve coordination with the governors will be established with the President of the Federal Senate. For our part, a committee will meet every week with a
dictatorship on the 46th anniversary of the 1976 coup. The historic street mobilization that every year sees hundreds of thousands of people gathered to pay tribute to the victims of the dictatorship installed in 1976 under the slogan "Never Again" was cancelled this year to avoid the spread of the novel coronavirus, which has claimed almost 55,000 lives in Argentina and infected more than 2 million people. The only march of the day was one called by a group of leftist organizations to the Plaza de Mayo in downtown Buenos Aires. Argentina formalized its withdrawal from the Lima Group on Wednesday, according to a press release from the Ministry of Foreign Affairs. The decision was made considering that the actions that this forum has been undertaking at the international level on trying to isolate the government of Venezuela and its representatives have not led to anything, while the participation of the Venezuelan opposition led by Juan Guaidó in the bloc has led to the adoption of positions that the Argentine government has not and cannot stand by. In addition, the authorities recognize that the blockades and destabilization attempts that occurred in 2020 have only aggravated the situation in Venezuela, especially for vulnerable sectors and in the context of COVID-19. Argentina reiterated that it will maintain its commitment to regional stability and seeks peaceful, democratic, and respectful solutions to the sovereignty and internal affairs of each state. Bolivian President Luis Arce arrived in Mexico this Wednesday to pay an official visit to the country following a formal invitation from his Mexican counterpart, President Andrés Manuel López Obrador. Arce's agenda in the country includes talks of a range of issues, as well as participation on Friday in a major event that pays tribute to the indigenous peoples of Mexico.
President Arce is our friend, our comrade, our brother. He is the result of a popular and democratic indigenous movement in Bolivia that proved a new way of ruling, always in favor of the people, especially the poor, the outcasts.
And as part of his visit, Bolivian President Luis Arce noted that democracy was recovered in his country thanks to the support of friends such as Mexico.
Manuel López Obrador, for me in particular, it is a double joy to be here, to be able to share with you the celebration of this important battle. But it is also symbolic for me to come to the country that offered me refuge, to the country that supported our process of change in Bolivia.
We'll be right back after this very short break, so don't go away. Welcome back to From the South. An Uruguay's Air Force helicopter carrying Pfizer vaccines against COVID-19 crashed on Thursday. According to the Ministry of Defense, a Bell 212 helicopter tried to make an emergency landing that caused the fire that destroyed the helicopter and the shipment, and 3 crew members were injured but not seriously. The shipment carried around 300 doses of Pfizer vaccines that were being transported by the Air Force from Montevideo to Russia and were intended to inoculate people over 80 years and health personnel. The helicopter was part of the distribution operation for the 3rd shipment of Pfizer vaccines acquired by Uruguay. Also in Uruguay, President Luis Lacalle Pou announced new measures this Wednesday aimed at curbing a rise in coronavirus infections.
We are not in favor of a full lockdown or compulsory quarantine. We have received enough encouragement to apply it, but we have refused, and we continue to do so because it is more a matter of principle than of practice. Unfortunately, our principles are, especially in this case, the ones we believe we have to take forward in the current situation of the country.
Paraguay's Health Minister Julio Borba said on Wednesday that a new variant of COVID-19 virus discovered in the Brazilian area of Manaus is already circulating in the country after the detection of 2 positive cases.
Unfortunately, we have to confirm that this morning we had confirmation that the P1 variant from Manaus, Brazil, is already circulating in the country. We have 2 positive results in this case. We are in a critical moment, and the only way to mitigate this situation is by decreasing social interactions and complying absolutely with all protocols. There will be strict restrictions for circulation, with the exception of circulating for essential issues such as food, medicines, and funerals.
And the Peruvian government announced that the coronavirus variant initially found in Brazil is behind 40% of cases reported over the last 12 months. The capital Lima, with 10 million inhabitants, is the Peruvian city hardest hit by the virus, with hospitals collapsing and people queuing to buy medical oxygen. The death toll figures also place Lima in the lead, with more than 22,000 fatalities, according to data from the Ministry of Health. The Brazilian variant had been detected weeks ago in Amazonian regions of the country, bordering Brazil, such as Loureiro, among others. Meanwhile, vaccination of the elderly has begun in Lima. Mexicans aged over 60 are receiving the Sinovac and Pfizer-BioNTech COVID-19 vaccines as the country nears 200,000 fatalities from the virus.
Seeing how people are dying, there is no alternative. I think it's a civic responsibility.
How we have spent the pandemic locked up. I have a year and 3 months locked up without going out. This is the first time I go out. I was allowed to go out to come here.
Kenya's Farmers League demanded the grassroots communities to be heard when action is taken against the pandemic. Action Research in 3 countries studied restrictions and concluded that they impact small producers and local markets. Oscar Elpelde has the story.
Winnie kits while we wait for the missing ones to arrive. They are the group of Kenyan Farmers League of Mulo in Awendo, Migori, which meets to validate the results of the research. They pray before the beginning. They thank for being together. Onyango interpreters a passage from the Bible. When you find a bone outside who it was, you must bury it in the same place you found it. Humanity, responsibility. More than 200 interviews have been conducted in 3 counties. They analyze the consequences of movement restrictions on their food system, also the management of the crisis that has made the government. They praise the best practices of small farmers, pastoralists, and consumers for building resilience. The conclusions will be read to the government soon.
While people were worried about how to get food, the only thing they heard was to wear a mask.
94 of the 234 interviewees said that the government's response during the pandemic was not sustainable. Many advocated on the need to diversify resources of income. They closed a Wendo's market and she was out of business. She was afraid to return to his post because one day the police used tear gas. She was left without money or food. The question is what message to take the government if new restrictions are applied. Orrua says the government must be very careful to ensure that the basics are distributed equitably. Mary asks the police for respect and humane treatment, recalling the case of a pregnant woman who was ill-treated on her way to hospital. Onyango was going to his son's house with the cows for dowry and the police humiliated him on the way. What the county government should do, says Dr. Titus, is bring people closer to essential services. The government took advantage of the pandemic to oppress those in need, while its partners continue to do business as usual and continue to make big profits at the expenses of the poor. The group analyzes its own response to the situation. Each person should wonder what he has done for the community during the pandemic, says Dr. Pastor Axet. They had to expend less money. They made a meal a day, sometimes made only out of millet. The pandemic had some positive effects, Odero says, as urban migrants realized the importance of investing in their rural places of origin. They also reinforced the cultivation of iron-rich indigenous plants, such as apoth, which strengthen their immunity.
There were government services which were essentially disrupted by the virus. While the government did exactly nothing to prevent people from contracting the virus, apart from public announcements they made.
When awareness is created, we create power, knowledge power within an individual. To say a wise no or to take action which is full of supporting facts or evidence of what is going to... we are trying to help the person see the future from now. So awareness is paramount, although it is the awareness that is going to bring change in attitude.
They are small food producers. They practice organic farming and create awareness, and little by little they organize, research, and propose solutions to live better.
Desde Mulo, Oscar Pelde para TeleSUR.
And we have more stories coming up after this final short break, so stay with us. Welcome back to From the South. Maritime transit remains suspended on Suez Canal, blocked by a giant container ship that ran aground on Tuesday. The 400 meters long vessel caused the paralyzation of a large part of the merchandise trade and raw materials worldwide. The Suez Canal is one of the world's most important trade routes, and about 60 ships pass through it, transporting more than 3 million tons in fuels, foods and goods. Experts estimate that another 48 hours could go by before the vessel ever given, registered in Panama, can be refloated. According to preliminary information, the container ship ran aground because of bad weather. This canal is the biggest one of these kinds in the world and is used by most ships to avoid going around the African continent. On average, nearly 50 vessels per day pass along the canal, although at times the number can be much higher, accounting for some 12% of the world trade. A Denmark-based maritime expert said if the cargo ship that has been wedged across Egypt's Suez Canal remains stuck, the impact on global trade could be huge.
The canal is potentially the most important canal around the world, has been for more than 100 years, and it is in reality is extremely simple. Either you go through the Suez Canal or you go the long way all the way south around Africa. And that's going to give you a detour of at least 5,000 kilometers by doing so. It really is as simple as that. And that means with a block in the Suez Canal, all shipping lines, and that also means all the customers of the shipping lines, need to think through a number of ramifications. Further to the domino effect, a vessel stuck right now north of Suez gets delayed before it gets out to Asia. That's going to take it another month before it's out there. But if the vessels don't make it out to Asia in time, they are of course also unable to commence their next journey with cargo from Asia back to Europe in time, which means the next journey around is going to be delayed up into Europe. Suez Canal is...
South Africa is one of the countries with the highest number of people suffering from TB. In 2019, an estimated 360,000 people were diagnosed with TB and 58,000 people died. We visited the Tygerberg Hospital, where valuable work is being done in research and treatment of the disease.
The burden of TB in South Africa is significant. At risk are the most vulnerable populations, that is people living with HIV, pregnant women, newborn babies, and people living in informal settlements. At the Tygerberg Hospital in Cape Town, the Tygerberg Hospital Children's Trust collaborates with the Family Center for Research with Ubuntu, FAMCRU, to generate awareness about the research and treatment they do in the treatment of TB.
So I think it's great that we have this partnership between FAMCRU and the Tygerberg Children's Hospital Trust, because what we need is to raise awareness about HIV and TB epidemics that are happening in our communities. And the only way we can make treatment better for our patients is to do proper research on how we can do it best. And of course we need the communities to work together with the research units so that we always have enough people that are willing to participate in research so that we can actually provide the community with the better treatment protocols that would be a better fit to our communities.
FAMCRU continues with research and clinical trials into finding more effective treatment of the disease. Nombonono Nkomo is a 36-year-old female who participated in a trial at FAMCRU. She successfully completed the study and a course of TB treatment.
My advice to the other women, I would like to say to them, when they find out that they have TB during their expecting, they must use drugs every day. They mustn't skip day so that they can get health and healthy for their babies.
Professor Mark Cotton is an internationally acclaimed specialist in the field of pediatric infectious diseases. He spoke about the importance of awareness around TB.
Our unit is always focused on HIV. And HIV in children is an absolute disaster for TB. Anyone who has HIV, you've always got to worry about TB. So especially when someone is newly diagnosed, the chances of having both are reasonably high. And that's for children and for adults.
Young scientist Dr. Caroline Pule is a goodwill ambassador for the Tygerberg Children's Hospital Trust. She says she chose this field hoping to make a difference.
I couldn't understand, a disease that has been in existence for so long, why people are still dying. And for that reason, I felt like, okay, this is maybe a right direction to go, to study TB, to do my studies, my postgraduate studies, and towards PhD, in trying to find out if maybe my knowledge of understanding what causes TB and what causes to be more resistant, and if there's any way that my research can add value to improving the current TB treatment and hopefully indirectly save lives.
The theme for World TB Day 2021 is "The Clock is Ticking," highlighting the urgency with which we must step up and increase our efforts to find, treat and end one of the world's leading infectious diseases. It is estimated that globally TB kills around 4,000 people every day, among them 700 children. Johan Abrams for TeleSUR in Cape Town, South Africa.
A poor neighborhood in Sierra Leone's capital, Freetown, was destroyed in a fire on Wednesday, with the victims' toll still unclear. According to Freetown City Council, the blaze could affect thousands of poor Susan Bay's Zone residents who could be displaced from their homes. Most homes in Susan Bay's are flimsy constructions or corrugated sheeting and recovered materials. The community is clustered on Freetown's seafront, close to the city's historic center. Turkish Foreign Minister Mevlut Cavusoglu told a group of Turkish journalists following a meeting with the U.S. Secretary of State Antony Blinken on the sidelines of a NATO meeting in Brussels on Wednesday that Turkey will not step back from its decision to operate the Russian S-400s.
We have told them once again that Turkey has already bought the S-400s and that the issue is closed. On the other hand, we remind them that we have not received the defense industry products that we needed in the past. We remind that Turkey is in a positive stance on procuring our needs from our allies, us being foremost among them in the future. We agree that we should continue to deal with all the issues with our friends.
And we have come to the end of this news brief, but remember, you can find this and many other stories on our website at telesurenglish.net. And also, if you feel so inclined, please join us on social media, Facebook, Twitter, Instagram and Telegram. For TeleSUR English, I'm Gladys Quesada. Thank you for watching.